Hello, everyone, and welcome to Open Therapy by Mental Expert Group. So, Open Therapy is a monthly free online seminar where we discuss mental health issues. Speaking to us today is Dr. Kumi, a clinical health psychologist who specializes in psychological trauma.
Thank you so much for joining once again. The focus of today's interaction is to give an insight into how therapy could change our lives significantly. And so I'll be talking about some of the things that therapy could do for us as a people, and then the need for us to prioritize therapy. So the first one is that therapy gives us clarity, particularly in the face of difficult decision making. Sometimes we go through life situations and we come to places where we need to make very life-changing decisions or significant decisions, and we sometimes need to make those decisions irrespective of the complexity that comes with them. And so it's at that point that seeking therapy will give us a perspective into who we are, why we are making the decision, and what our motivations are, and also what we seek to gain, and whether we even have the internal and external resources to take advantage of the opportunities that may come with the decision. So in therapy, you may get opportunity to explore these things. So for instance, a patient comes to me and wants to make a change in their job, and because he has a better job which promises more income and then some form of luxuries. However, the patient came because he's also living a job that he finds a bit fulfilling, or more very fulfilling, and then also has some other family responsibilities. Meanwhile, this new job may require that he stays out of home a bit more. Under such a circumstance, it's always important to, or what I did with the patient was to look at the patient's personality and the patient's situation, whatever is going on, what's going on with him at the time. Look at his internal resources, external resources, and then what his career objectives are. That's what therapy does. It gives you a wide view and a bird's eye view of the situation in the light of your person and your motivations, even your hidden motivations, and then eventually may be able to make the right decisions. So that's the first thing therapy could possibly do for a person. And this cuts across whether in terms of making a job or determining a marriage partner or any other thing that requires some form of clarity and requires a lot of perspective, irrespective of the complexities that come with it. The next transformational advantage therapy gives is that it gives some self-awareness. And self-awareness is a crucial element in our daily living, in achieving success in every facet of our life. So in therapy, one is likely to learn more about or come to an awareness of their thoughts patterns, what influences their decisions, their intrinsic motivations, their unconscious desires, and their emotional states, and what informs the various emotional states. So therapy gives us an awareness of these things, and with this level of awareness, we are able to make quality decisions that go to help us in the future. For instance,
it changes the way we see ourselves. So in the grand scheme of things, our awareness of ourselves within that period of time becomes very, very essential, because someone may know you as very calm, collected, and the like, and then at some point they find that maybe you become a bit withdrawn, okay, or you become a bit confrontational. So self-awareness, what therapy does is that while we are going through different phases of our lives, at some point you didn't have a girlfriend, but now you do, okay, those kinds of changes require some form of self-awareness. And then at some point you were not working, but now you do. And when we start working, sometimes there are demands on our lives. Okay, your mom, your dad, your siblings, societal expectations. And not everyone is able to come to that place of awareness that, okay, now I'm earning, so this is how I'm supposed to live my life. I'm supposed to budget every now and then. So you find that you take your salary, and then by the time we get to the middle of the month, it's gone because you were busy sorting people out and taking care of bills, instead of possibly being aware that you have other personal responsibilities or career goals or life plans that needs your attention. And so the idea of being in therapy will help us to be self-aware of what we are going through. What am I going through right now, and how do I maintain my balance as I am going through this phase? Sometimes things happen to us unconsciously, and once things happen to us unconsciously, sometimes we lose sight of who we really are at that point in time. And therapy helps us to find ourselves from every phase of our life, from one phase of our life to another. Okay, so that's also another importance of therapy. That's how transformational therapy can be. And then there's also grounded. It makes you grounded and authentic. So um, when people seek therapy, sometimes it's not because they have a mental health condition per se. It is just because sometimes we need to find ourselves in this world of many voices. We need to find ourselves, and then also identify what weighs us down. So what therapy does is that it transforms the way we see ourselves. It transforms the way we relate with others in the light of their image, and in the light of our own image. So let me give maybe an example to bring this home. So sometimes, as we are going through various life circumstances, for example, if you lose a loved one, sometimes by losing a loved one, we feel very vulnerable. Okay, we feel like we need other people in our lives to thrive. Sometimes we feel like we need someone to hold our hands, because the person we lost played that particular role in our lives. So the essence of therapy, how therapy transforms us, is that you find that when you go for therapy, your eyes will be opened to who you are as a person, your personality, your uniqueness, your giftedness, and your sense of self. All these things will be heightened for you to see. And then therapy will also help you see how you are in the light of other persons. So I'm a very quiet, reserved person, but then when I lost my dad, now I need to go out there. There are things maybe my dad could have done for me, but now I need to do all these things by myself. And so sometimes these things can change us, they can break us. So the quiet, calm person now becomes a bit aggressive, a bit competitive, because there's this desire or demand on him or her to thrive. But when you come for therapy, or in therapy, you find that you can still be calm, collected, and still thrive. So the idea, sometimes people's voice is, hey, now that you've lost your dad, you need to be strong. Life is not easy. And all those kinds of comments, you'll be able to quiet those voices, and then thrive and still find your authenticity and still be yourself without changing to become something you are not. And mostly we change to become what we originally are not, because we lose sight of who we are. But in therapy, you find yourself, and you would find how you can thrive in the light of other voices in our lives. So that is one. And then the fourth one is that therapy also gives us the ability to gain insight. Sometimes we are gifted, but we don't know. Sometimes we can pick up certain opportunities in life, but we don't know. Sometimes we have certain resources, unique resources we can leverage on, but we don't know. Uh, so how come we don't know all these things? Because in the grand scheme of things, you'd find that most of the time we are bedeviled by so many things and so many um, thoughts from people. So, for example, I was attending to someone, and this person was mentioning that he's been to school, he's done all his courses that he could do, but he still felt that he was inadequate. Okay, so we examined all his advantages. He had wonderful oratory skills. He could talk so well. He had good public speaking activity and strength. Okay, even though felt less of himself, he had this unique sense of boldness. He could talk to people with relative ease, with some optimum level of mental coherence. So he could articulate his thoughts a bit more easily than the average person. And all these things, this young man did not know about himself. So he was just submerged in not thriving because of what he didn't have. But therapy made him realize that, hey, you have these resources and you can leverage on them for the future. So sometimes therapy gives us an idea of the resources we have, our giftedness, our talents, our academic prowess. Sometimes we live we don't realize how much our past enslaves us. So therapy opens our eyes to the fact that you are not that child who used to be disrespected by your teachers anymore. You have this potential and you can leverage on it. And then also it opens our eyes to all the possibilities. I mean, to a significant amount, the number of possibilities ahead of us. Because most therapists who have trained for a while or have been practicing for a while have perspective. They work with different people from different backgrounds, different life paths, and all. So they're able to cast a good light on a person's future. So we see what we are capable of, and then we can take advantage of them. We also need to bear in mind that you find that when you are in therapy and your therapist opens your eyes to these things, and you come to know your internal and external resources, you also have your therapist to be by your side, so that when you feel anxious about what you are doing, he's able to help you know that, okay, the anxiety you are feeling is not really there. It's just your past or your present situations trying to sabotage you. So this is also one of the transformative power of therapy. Okay, and then um the next one is that therapy makes life, it gives us a sense of meaning and purpose to life. So um you'd find that sometimes we want to juggle so many things at the same time. It's sometimes about money, and because we don't have money, we want to go to school, and because we know that when we go to school, we'll be able to um, take advantage of our certifications and get into certain classes of jobs. So that is one. And then sometimes while we are thinking of that, we're also thinking about, okay, don't have the means to pay my fees, so let me start a side business. And then we start a side business, and then sometimes we think that the business can give us so much that we can gain some comfort, so we just keep going and going, not recognizing when to stop and what to prioritize. So for some people, they'll take a very huge maybe loan, and then start doing business while they are still in school, not taking into cognizance the fact that while you are in school, you need a certain level of attention, and you need a certain level of control over time to be able to finish the school on time, and then also get your certification. So in therapy, you would find when you have to make such a decision, you'd find that you can in therapy, you'll be able to see exactly what your life purpose is and what meaning that brings to you. Then you can make some informed decisions on the basis of that. um, Once in therapy, a client of mine was experiencing panic symptoms. Her BP was going up, and it's all because she felt that the meaning of her life, the true meaning of her life, is to support her mom, who has been a single mother for a long period of time. And now that she's working, it is a responsibility to take care of her mom. So for her, that was meaning. And she would do everything. She didn't have so much, but she wants to get her mom to see a cardiologist because of her mom BP. She wants to get her mom to, um, do some exercise, register her for a gym. So she had all these big ideas for her mom. But the point is that, was that meaningful? So in therapy, she found that all the things she wanted to do were things which were burdening her. They were a huge um, burden on her. However, those were things her mom did not really find meaningful. So she tied the meaning of her life around the well-being of her mom. But in therapy, she realized that that may not really be what mommy needs. So she went back, had a conversation with her mom, and then her mom told her the actual state of her health. Then she found that, oh, okay, she's not even dying tomorrow after all. So she came to realize that this burden to find money and book to see a cardiologist for her mom and register her for a gym, all of those things were weights she was carrying because she felt she needed to do that for her mom. Eventually, she came to realize the true meaning of her life, and what a meaningful life is, in the light of or from the perspective of her mom. It was totally different from what she thought was meaningful. And so she was able to prioritize. And then, right after prioritization, her perspective changed. And then you'd find that, or we found that her panic symptoms just eloped, just went out of the window, and then she was fine. So therapy can be that transformative, where it gives us actual meaning and purpose based on the interactions the client has with the therapist and the interventions. And then you soon find that some of the things which really weigh us down, we are able to find ways to handle them. So that's also one of the um, uses of transformative power of therapy. So yeah, and then the next one is to uncover or to uncover our unconscious purpose, or to unveil our unconscious power. Sorry. So in therapy, there are so many of us who have power, hidden power, that sometimes they are very we've been socialized in certain ways such that this hidden power does not become evident to us. Okay. And but in therapy, you find that you are stronger than you think you actually are. So sometimes we define our strength on the basis of how much money we have, the schools we attended, who our parents are, the friends we have, and stuff like that. But then in therapy, you would find that you possibly have certain significant powers. If I say powers, I'm not talking about to just move a magic wand and then something shows up. I'm talking about intrinsic capacities that we possibly didn't know. And in therapy, these things become obvious to us. So let me give one example. So I was attending to a client, and she didn't she was very concerned about herself, her body image. Okay. And she didn't know the how much power she had in that same body. So her body was something she didn't like, but then in therapy she was able to find that she could actually take advantage of this same body that she didn't like. So the point is that sometimes we are beautiful, but we cannot see it. And in therapy, you find that beauty is not just in the color of your skin or in the on the based on the smoothness of your skin. Sometimes in therapy, you find that beauty sometimes is in just the shape of your eyes and the shape of your lips. Okay, sometimes beauty is in the way your fingers are. Okay, and so sometimes in therapy you would soon find that there's that thing about you that is rare, and then you can take advantage of it. So we have unconscious power. Some of us have been raised in a certain way, and sometimes they can become our greatest burden. So for some people, the way we are raised, we feel that if my parents had this, if my mom had that, if I could have this in life, I'll be okay. But in therapy, for example, I've had clients and they didn't know that hawking, they've had to hawk to make a living. And they've seen their classmates while they were hawking on the streets. And these things broke them because they didn't feel like the regular child whose father will pick them up in a car. But in therapy, they found how unique and how gifted they were because of what they had been through. Okay, so sometimes in therapy, you would find that unconscious power on the inside of you, and then you can leverage on it to make certain meaningful life choices. So that's also one amazing power of therapy. And then therapy also gives us an opportunity um, to get a diagnosis. I know uh, personally as a clinician, I'm not keen on diagnosing people, even though it's important that I do that and I'm trained to do that. But I'm more interested in helping people find themselves than in, for want of a better expression, putting a label on them. That said, having a diagnosis can also be highly transformational, extremely transformational. So, and why is that? Because sometimes we go through things and we really do not know exactly what is going on with us. Okay, we really do not know what is going on with us. But when we are in therapy, we are able to find ourselves that, okay, um, I always feel very jittery, and I notice that my vision becomes blurred and my head becomes light whenever I have to do a presentation in school or at work, or even when I have to talk to an adult figure in my life. But in therapy, you sometimes people are concerned. Oh, I don't know. So whenever I get an opportunity to do something like this, I don't take it. Okay, so I applied for a job and I realized that just when they told me as part of your interview process, you'll be doing a presentation, I decided that I won't take the opportunity again. So sometimes, and people wonder what is going on with me, because later on they come to find that they could have done whatever the job requirement was, and they've lost that opportunity because they couldn't um, figure out what was going on with them. So at that point, it becomes extremely important to um, to put a label on, if I say, or to diagnose what is going on, and to help the person see exactly what is going on. So sometimes what I do with my clients or my patients is that I'll let you read on my impression of what may be going on. That's my diagnosis. And then when they read their diagnosis, they come back and go like, oh really, I never knew this was what was going on with me. I didn't really know I was suffering with anxiety, and this thing has taken over my life all this while. I wish I knew this. So they begin to talk about how useful coming to know what was going on with them is to them, in terms of how eye-opening it is, and how liberating it is, and how um, unique they are in that sense. Okay, so they don't beat themselves up by saying I'm a weak person, I'm a troubled person, I'm incapable and all of that. Once they come to know the diagnosis, it gives them some form of clarity about who they are and what they've been experiencing. And then they realize that it's actually not something too far off the ordinary. And the beautiful thing is that they also come to find out that, okay, since there's a diagnosis, then there should be an intervention to help mitigate the impact of this diagnosis. And the beautiful thing is sometimes my clients will come in and they tell me that, oh, I read and I found out that this is actually what has been happening to me. Thank you so much for making me realize what has been happening to me. And you know what? I actually read and I found out ways to deal with this. So you see, that diagnosis now becomes empowering. It gives that person that sense of control over their life and over what has been happening to them. They can now read, they can request for resources, and then they are empowered to deal with what they are going through. So a diagnosis, that is one of the useful things about therapy. You are likely to get a diagnosis it once necessary, and that gives you a sense of direction in terms of how to handle what has been happening to you all this while. Some people, let me just add this to it, that some people experience broken relationships, like um it's so incessant. Every relationship they try to build doesn't work, and then sometimes it becomes like a whole mystery to them. But in therapy, sometimes they're able to find that what exactly there is that is causing them to lose all their relationships. And then sometimes it's tied to a diagnosis. So once they come, oh, okay, so sometimes I even self sabotage. Oh, this is what I used to do. Then they are empowered enough to handle their next relationships a bit more meaningfully and with tact. So that is the power of diagnosis. It's not just a label, it is not to tag people. It is liberating sometimes to get a diagnosis. And then the last one is mind body connection. So some of us do not know why we are sometimes physically sick all the time. Okay, and therapy helps you know why you experience certain physical sicknesses or illnesses. Some people have lived with migraine almost all their life, and they do not know why this migraine never stops. They've done an MRI, they've done a CT scan, they've done an EEG, and I mean, they've traveled the world just to find out what is going on. And sometimes the MRI, the EEG, the CT scans, all these things are negative. So then it becomes a whole mystery that cannot be unraveled. But in therapy, now we know that there's actually what we call monism. The mind and the body are interconnected. They are not one and the same per se, but they work together as a system. And what happens to our mind or to our emotions and our mental health could significantly explain what is happening to our physical health. And so sometimes in therapy, people come to realize how their physical health is being impacted by their mental health. And again, there are so many experiences. I had a patient who always had a skin condition. It never seems to abate with irrespective of the interventions, the medications, the antibiotic. Nothing was happening, and they were concerned because this skin condition was now beginning to make them feel ashamed of themselves publicly. But then when we found a diagnosis and they realized how that diagnosis or how their mental health is impacting their physical health, they then went on to implement all the interventions that we put on the table, and then in no time the skin condition begins to resolve. So that is how powerful therapy can be. Some people have, I mean, all manner of medical conditions and mostly unexplained medical conditions. All the labs are negative. Your physician does not seem to know what is going on with you. And unfortunately, our healthcare, or even globally, healthcare system does not really integrate the practice. We don't work so closely together such that a dermatologist, that's a doctor who is handling your skin, is able to quickly connect that, okay, I've done the physical labs and everything is clear. So let me move this person to see a psychologist. Our training is not really intertwined like that. The orientation is not there yet, but we are trusting that in time or over time we will come to that place. So sometimes people leave and, oh, this dermatologist couldn't help. They go to another one and they go to another one. They've tried all the skincare products and still there's no remedy. And sometimes they just don't know how to handle themselves at that point. But when you come for therapy, we're also able to do the psychological assessment and we find out, oh, okay, actually it is this particular stressor which is causing this skincare condition to recur from time to time. And then when we put in the intervention, you find that the body gets the healing that it needs. So these are 8 things which make therapy very, very transformative. And I hope it is helpful.
Okay, Dr. Paul, thank you very much for this presentation. It has been very insightful. Thank you so much. And so we want to give time for questions. And so if you have a question, kindly raise your hand, or you could equally type it in the chat box, and then we would address it for you. Thank you.
So for those who just joined, we've spoken about 8 different benefits of therapy or transformative benefits of therapy. And we've spoken about the fact that therapy gives us clarity, and then also it enhances our self-awareness, and then it grounds us and helps us to find our own authenticity, and then it helps us to get a clear view of the future, and then also it makes us live more meaningfully and purposefully. Then therapy helps to uncover all our unconscious or intrinsic powers, and then it helps us to sometimes find a diagnosis so we can understand what has been going on in our lives or with us. And then finally, it helps to address some physical health conditions that we experience from time to time, which sometimes are difficult to explain. Yeah, so these are the 8 things therapy or benefits therapy gives us. And these are the 8 things that makes it useful for us to seek psychological help when need be. All right.
My friends tell me that therapy is usually for the rich people. What can you say about it?
Well, so therapy is not for the rich. It used to be for the rich, but it's no more for the rich. The reason why it's no more for the rich is that life happens to both the rich and poor. The other reason is that sometimes for those who are wealthy, they have a certain level of exposure, and that exposure helps them to seek help with the least thing that may be happening to them. That's why it looks like it's for the rich. So typically, let's say when you are born into quite an affluent home, or once people are born into affluent homes and they are struggling with their, let's say, their academic work, chances are their parents will go to the school and find out what is going on with their child. Mostly these schools, because they are more for the wealthy, they may have a system that is able to assess and not necessarily tag the child as a weak or a dumb child. And then they are also able to guide the parents to, okay, let's talk to a psychologist, let's see if you can get a cognitive assessment done. And then the rich will follow through because they have a certain leverage in terms of their finances to pay for the service. And then also sometimes most rich persons value, they put a premium on intellectual capability. So they will go all lengths to get their child assessed and then find a remedy to whatever may be going on. And that's why we sometimes think that it's for the rich. If for those who are not so rich or wealthy, it's going to be, why are you not performing in school? I'm paying your fees. I'm doing all that I should as a parent. You know how I'm struggling to get by. Please sit up. So it's a lot more of the putting the blame or the demand on the child. And I mean, you can't fault such parents or families because sometimes the returns are very meager, and so they need to work with what they have. And paying for mental health care or physical health care can sometimes be too demanding. So that's why in times past it looked like it's for the rich. But now we've come to realize that health is wealth. If you prioritize your health, you are in particularly your our mental health, because with good mental health, we can thrive. So once we prioritize our mental health, we are more likely to get the returns on our physical health and even on life in general. So not anymore. Now therapy can actually be as low as 50 CDs and 80 CDs. I mean, I know that is also relative, but then it could be that low. And even for some of us, we don't mind offering free services. So I just want us to leave with the thought that once I need to get help or see a psychologist, I'm going to do so. And even if I don't have the means to pay for it, or I'm going to try and find out if this person or this practitioner can work on the figures for me, and then you get the care that you need. But to shy away from it could be very detrimental. I found that once I was attending to a man so gifted, but never really knew how gifted he was. And he had been suffering a particular mental health condition for almost 25 years of his life. And because of that mental health condition, he couldn't keep a job. Okay. But as I interacted with him, I found that he was very, very brilliant. You know, the amazing thing, his service was free. So I attended to him free of charge. I spoke to my other colleague who is a psychiatrist. We were able to put him on some medication, and with the medication and psychotherapy, he's found his life, and he's doing what he's always desired to do, which is to live independently. Okay, but mind you, this man had been living 25 years of his life unable to do whatever he really wanted to do as a person. So sometimes when we don't seek help, we end up wasting many years of our lives. But when we seek help a bit early, irrespective of our financial strength, most of the time we are able to get the needed support, and then we're able to thrive and live the life that we want to live. So that's also one of the use or leverages therapy gave us. All right. Thank you.
Okay, thank you very much. Thank you. So we have a question from Irabna, and she's saying that I want to know, does that mean every time you experience a physical symptom and physicians don't really find a diagnosis, should you still check your mental state?
Absolutely. I mean, mind body medicine is the way to go now. It is the ish, as is it Gen Z people will say. Yeah, it's the ish. So once, I don't know how many physicians there are on the call, but then once you get a physical check and you find that there's no explanation or to the symptoms you're experiencing, then it is the next best thing is to get a psychological check. And most of the time when you do your psychological check, you would find the explanation to the physical symptoms that you've been experiencing, and it could be any kind of physical symptoms, including infections. Okay, sometimes we tend to think that infections are purely physical, but some infections now we found that could also be aggravated by the state of our mental health. So, Irabna, that's an answer. That's the answer I think I can give. I hope this helps.
Okay, thank you very much. So we'll move on to the next question from AB. AB is asking, what's the best way to improve my mental well-being?
My prescribed approach is that, first of all, make sure you are not alienated. Okay, build a good social support system. And sometimes when we are struggling with our mental health, that's something we shy away from. But make every effort to build a good social support system or a good social network. A good social network is those people you can sit with and talk about nothing in particular, have a good laugh. And when you really need to talk about something in particular, there are those people within that social network who you could fall on to discuss what may be going on with you. That's the first one. The other one is that let's also value the need to prioritize and not dismiss what we are experiencing. So sometimes you're experiencing something, you notice that your mood is changing from time to time, and that's not how you actually are originally. Or sometimes you find that you are a bit numb emotionally. Funny things are not funny to you anymore, stuff like that. Sometimes we dismiss them by saying, "Oh, there's nothing going on with me. I'll be fine." Once you do that, you would find that lurking mental health struggle is going to stifle your progress significantly. So always be aware of how you are changing as a person and make an effort to document if you can. So by this I mean journal. Write the changes that you are going through, and then as you write, you soon see the nuances in the changes. You see the how how you are changing from that one person to the other based on what people are saying and the like, and that gives you some form of clarity. So journaling is also very, very important. And then the third one is that always do something. Okay, do something, do some gardening if you have the land. Okay, tend something, raise someone. Okay, maybe you don't have a child, but you have a nephew, or you have a brother's child, or there's a school around you, you could volunteer your resources. Do something. What's the power in doing something? When you start doing something, two things happen. You would find that you don't become fixated on what you are going through, because you wake up each day with something in mind, even though it may be voluntary, you may not be earning directly from it, but your soul will be refreshed every day because you are doing something with your life. And then the other one is that you'd soon find that as you start doing things, you meet different people, you hear stories, you soon find that you are not what you are going through is not unique to you, and sometimes that gives some strength. And then also prioritize your self-care. So take a shower every day. I always say that in terms of prioritizing our mental health or improving our, make sure you are taking a shower every day. When you wake up in the morning, feel fresh. And then before you go to bed, make sure you are feeling fresh. If you can do some walks, if your neighborhood is safe, you can do a dawn walk. Okay, so 5 a.m. the sun is not out yet, so go out and enjoy nature. And then in the evening, also sit outside and watch the moon. Okay, enjoy some fresh air. So treat yourself to some comfort, okay, which may not necessarily require money. The last thing I would say, because of the possibly the other questions, is that try and make sure that you talk to somebody, even if it's not a therapist. Talk to somebody consistently about what you are going through, and make sure this person is not just that person who listen and not really give perspective. So have different people in your life. So have that person you can talk to about money, have that person you can talk to about your relationship, have that person you can talk to about work, have people you can talk to about your life, and be vulnerable to those people. Once you have that kind of person whose perspective you value, and not just that person who sugarcoats things just so you feel comfortable, soon you find that there are things that you possibly didn't know that becomes clear to you. But finally, as you do all these things, try and get checked with a professional. The idea behind seeking professional help is that there's something always, there's that unique touch a professional brings to the table. So people can advise you, people can tell you things, but when you meet a professional, he's likely to guide you on the basis of his observations of you or your resources. So that's the unique thing about seeing a professional. When you see a professional, all the things that you possibly may not have been aware, like I've shared earlier, will become clear to you. And then you are likely to also find the right way of handling what you are going through. So the last thing, which should usually be the first under ideal circumstances, is to seek professional help. Thank you.
So my question I typed it earlier is that, is it necessary, or if someone is not necessarily going through psychological distress and they just want to talk to someone for the sake of therapy and its benefits, what can they get from that?
Awesome. So actually, therapy is not meant specifically for people who are going through psychological distress. So let me give one example, or one of my thoughts now, that before you get married, go and see a therapist. Okay. It's not because you are going through something. I mean, preparing to marry can be exciting most of the time. But the idea is that when you go and see a therapist, even when you are not going through psychological distress, you are likely to benefit in two ways. One is that you'd come to appreciate your person. There's something about talking or having someone listen to you genuinely and knowing that this person has an understanding of what I'm talking about. Okay, there's something beautiful about being heard, and being heard without any strings attached, any form of judgment. That is one of the benefits of therapy. Just go and talk, and you don't have to apologize for talking. Sometimes when we talk to regular people or friends or significant others, we feel like, oh, I'm talking too much. But this one, you possibly have paid to talk, so just go and talk. And the beauty of it is that the more you talk, the more aware you become of yourself. And then your therapist is able to pick very little things based on the scale of the person, very little things you say, which could heighten your awareness of yourself. So sometimes people can say things like, oh, and you know what? The last time when I went to work, this person said this, and it really got to me. Now, when you say it really got to me and you move on, in an ordinary conversation, the person is willing to hear, okay, it got to you, okay, so I was this and I was that and I was very angry and all of that. But a psychologist will make a mental note of, it really got to me, take you back there and ask you to unpack what you mean by it really got to me. And it's a beautiful thing to do, because soon as you begin to unpack that word, it really got to me, you find so many things about yourself. Like, okay, I don't like people who raise their voices. I'm quite sensitive to people who laugh too much. And you see, you come to see yourself so clearly. And that's one of the beautiful things about seeking therapy, even when you are not in psychological distress. The other one is equally important, which is that sometimes we have been through so much that we've been bent backwards over by certain experiences, and we don't realize how these experiences are impacting our well-being significantly. So you may not necessarily be going through any distress, but going to see a psychologist, you find out, oh, okay, I didn't realize how this thing is affecting me, or I didn't realize how this thing has impacted my life. And then you would now be able to gather some resources to deal with those things in your life. So this is how transformational therapy can be, even when we are not experiencing any form of psychological distress.
How can a person determine if therapy is the right choice for their mental health needs?
Okay, therapy is always the right choice for your mental health needs, because just like food is made for hunger, therapy is made for mental health. That's why so therapy is just the right choice for your mental health need. I'm sure someone may be thinking about other forms of therapy, but usually when it comes to mental health, I always advocate that start with a psychologist, start with a clinical psychologist. Okay, because a clinical psychologist is trained to understand psychiatric presentations, and then also trained to understand psychotherapeutic presentations. So there's a difference. So a clinical psychologist will know when you need to talk to a counselor or a counseling psychologist. There are different types of psychologists. A clinical psychologist will also be able to determine whether, based on what you're experiencing, you need to talk to a psychiatrist or you need to talk to a general practitioner, maybe a particular type of doctor or a general doctor. So always, when it comes to mental health, the first person, based on my experience, one needs to engage, particularly if it's not an obvious psychotic presentation. If I say psychotic presentation, maybe I'm hearing voices or seeing things which are not there, stuff like that. If it's not an obvious psychotic presentation, always talk to a clinical psychologist first. And once you talk to a clinical psychologist, if the person, of course, has the requisite skill, they'll be able to tell you that, oh, okay, based on what you are going through, I think the crux of the matter is your marital issue. So, because the crux of the matter is your marital issue, let me refer you to a marriage counselor or a counseling psychologist. Sometimes, okay, the crux of the matter is a marital issue, but it has impacted your mental health such that you are feeling depressed. And because you are feeling depressed and anxious, that is for me to handle. So you go and see your counseling psychologist or your marriage counselor for the marital challenges which is causing the mental health condition. So at that point, you have two specialists attending to you. One is handling the marriage as a challenge, the other one is handling your depression or the anxiety you're experiencing. And sometimes your clinical psychologist could tell you that, oh, go and see your marriage counselor over the next 4 weeks and come back and see me. I believe that after 4 weeks of marriage counseling, your anxiety and depression should abate a bit or should resolve to some extent, and then come and let me assess. Once you are doing well, I don't have to even treat your depression because the counseling is helping with that. And it also goes in the same direction for psychiatric conditions. So I always say that, just I mean, to answer your question, just as food was made for hunger, I want to say that therapy was made for mental health. That's why therapy is the right choice for mental health needs.
Has there been a time where you had a patient who sought for psychological support, and after a while, let me say after a few sessions, the patient or the client felt, I haven't really gotten over my problems, but I think it's okay, and so I wouldn't need therapy again, sent you a message or called you with regards to that? And if yes, how did you handle it?
Interesting. So sometimes our patients or our clients may feel better subjectively anyway because they think that whatever they came for has been touched on, or they've learned enough skills to deal with whatever they are going through. One thing is that patients have autonomy, okay, and we cannot determine what they do. We can only guide them to see essence, okay, in what we may be prescribing to them or suggesting to them. Largely, when a patient decides to step out of therapy, even though the clinician thinks that it's not yet time, the best thing is to explain to that patient what you would have loved to do going forward. So a patient comes to me and says, okay, I don't think I feel anxious again. All my symptoms are gone. So thank you for your services. And if I have any challenge, I'll come back. But for now, I don't think I need the service. That's okay. You, the clinician, possibly think that you didn't get to that place where the patient's anxieties would may not surface again. So you would have preferred to continue the care till that point. What you do, like I've said, or what I would typically do, is to let the patient know that, okay, ideally, I would have loved to continue care with you because of 1, 2, 3, 4, 5 things that once I address, I know that your symptoms or your presentation may not resurface. However, I recognize that at this point you don't want to continue care. So that is fine. This is what I would want you to do while you step out of care. So try and prioritize this, that, and that. And then if you have some resources you can share with the patient, and then you open the door. So you tell the patient that, oh, whenever you deem fit and you think you need my services, you could always come in. That allows the patient to leave knowing that you were not peeved by he or she dropping the care, possibly in your opinion, in the middle of it. And that also allows the patient to conveniently come back to you whenever they need care. And I've had this before. I mean, a client of mine called one day and said, oh, I like you so much, you're so good, and your services has been so wonderful, but then I want to switch to a different person, and I would prefer a female, and I prefer someone who is practicing abroad, stuff like that. So what I just shared with you were exactly the things I did. So I explained to the patient everything that I just shared with you, and then social cultural studies, I gave the patient my blessings. So the patient went on. After a month, the patient comes back to say, "Oh, I actually want to continue care with you, and are you willing to take me back?" I said, well, why not? I mean, that's my job. So I continued care with the patient, and the point is that I never asked the patient, why did you leave that person to come back to me, or and then resolve to come back to me? Never, because that was not necessary. What we agreed on was that you are autonomous. You can decide when to stop care. I have a responsibility towards you, which is to make sure that you are well, even though you are moving on. And when the patient came back, whatever I need to do for the patient, I'm doing it for the patient. So yes, it does happen And we need to be very dispassionate about these things so that we as clinicians are not broken, because sometimes we become a bit concerned about our patients. I hope this helps.
I think when he was talking about the way people can reduce or people can actually cool down on some of the depressions, he mentioned that it's something like we should be talking to people or friends sometimes. And sometimes now I wanted to find out, is there anyone we can actually discuss our psychological or things that are bothering us mentally with? Because what I'm saying is that some people can actually make the issue escalate, and sometimes it can be detrimental.
That's a good one. That's a very good one. So and that's so true. Sometimes people can worsen the situation. That's why we always recommend that just go and talk to your psychologist. And I mentioned that find people who can help you. So sometimes it's obvious that this person is a friend or this person is a relative, and he might just dish it out to you left, right, center. Okay, and so we need to be mindful of who you are talking to about certain things. But the ideal situation is to talk to a mental health practitioner. And now we are all over the place. When you go to Rage, there's a psychologist there. When you come to UGMC, there's a psychologist there. Yeah, sometimes people are not sure where to go. That's why we are doing something like this, so that you can reach out to my team. And then if we need to send you or recommend someone, we know that this person is skilled enough to attend to you. So that's why we are doing this, so that we can all seek care from safe places and not have our mental health broken. That is my response to you. I hope this is useful.
Yes, please, it has. Thank you very much. All too soon, we've come to the end of open therapy. Before that, we just want to say thank you to Dr. Paul for sharing these with us. It's very helpful. Thank you so much. And we also want to appreciate you for joining us. Dr. Paul, please, do you have any last words before we wrap up?
Yeah. So I just want to remind all of us that mental health is great wealth. Ideally, each one of us should see at least a psychologist at least twice a week, twice a year. Every half of the year, you go and see a psychologist. Just talk to the person, get an assessment. And thankfully, I'm seeing that quite often now. People just come in and say, "Oh, I just want you to check me out." Okay, so just get an assessment and talk to the person and see if there's something you haven't unpacked yet. So that is one thing I want to leave all of us with. And the other one is that don't wait for your mental health to deteriorate before you seek help, because sometimes it would cost you so much time, so much resource, so much opportunities, or so many opportunities if you don't seek help early enough. So don't wait for that moment where you cannot sleep at all, or those moments where you are mind dumping. Whoever you see, you talk about your problems with. Don't wait for those moments where you feel very low sometimes and you don't want to talk to anyone, or even those moments where you wish you would sleep and not wake up, or you actually feel like taking your life. Don't wait for those moments. The very moment you notice that you are struggling with something, or you are in a fix about a particular life situation, reach out and seek mental health care. If you know somewhere you could go, simply go there and talk to a psychologist. If you don't have anywhere to go, that's why we are doing this. So you can reach out through email. I'm sure your emails were picked that, oh, I would need some help. Even sometimes it's a simple question like, oh, I'm going through this and I want to know if I need therapy or not, or I need a psychologist's opinion on it. And then your questions will be answered and the needed help will be given. Thank you all so much, and God bless you for making time.